There are a lot of reasons that patients would see neurologists. It ranges anywhere from relatively simple things like problems with headaches that are not going away with just simple treatments, to more complex diseases like multiple sclerosis, seizure disorders, Parkinson's disease, stroke.
Often we run tests and perform different procedures that help not only diagnose their main issue but also rule out more serious problems that could be potentially life-threatening.
I saw a patient who read in their hospital record that they had cephalgia, and they had no idea what that meant. They even looked it up and couldn't find out. It just means headache. So as soon as I was able to sit down and explain this to them, just that alone really took a lot of anxiety off their mind. I feel I'm able to discuss with them in plain language what's going on. I think on the surface, it seems like an unusual combination of specialties to have in one office.
I love the way that our practice is set up because we have access to the different specialties.
One big advantage is that if a patient needs to see one of the other specialties in our group, such as our pain management specialist, neurosurgery, or orthopedics, I can literally refer them across the hall to one of my colleagues.
And I could just walk over and talk to Dr. Marotti, Westphal, Argires, or Becker and get their opinion about the particular patient and specific problems that they're experiencing.
I think I have two main jobs as a doctor. One is to diagnose and treat disease, of course, but equally important, I think, is to be able to communicate with my patients.
My goal is to find a best course of treatment for their problems.
One thing that I think is really important for me to do is to make sure that when the patient leaves the office, that I've addressed their concerns, their anxieties, their fears.
I think it's important for my patients to keep a positive attitude, and it's a big part of my job to help them stay positive. I really want them to continue to strive to live a normal life as possible. I had the opportunity to take care of a very young patient in the hospital who was admitted to the intensive care unit and placed on a ventilator and looked like she was going to die. We went and saw her and were able to diagnose her quickly and correctly. She was a young mother who obviously had a lot of responsibilities with 3 young children, and she was able to get back to working as well as taking care of her kids.
I think that even a lot of other kinds of doctors don't realize that there are now treatments available for patients with different kinds of neurologic problems that were not there 5 or 10 years ago. For example, especially multiple sclerosis, Parkinson's disease. There are treatments that offer a lot of hope for the patients with even these serious neurologic problems.